Tonight's bedtime lesson is about measles. Measles is a viral infection that spreads very easily. It's unpleasant and can sometimes have serious complications. Having the measles, mumps, and rubella vaccine is the best way to prevent it. Anyone can get measles if they haven't been vaccinated or they haven't had it before. People usually recover from measles 7 to 10 days after the symptoms appear. And now that's what we're coming up next, the symptoms. The first symptoms of measles develop around 10 days after you're infected. These can include cold-like symptoms such as a runny nose, sneezing and a cough, sore red eyes that may be sensitive to light, watery eyes, swollen eyes, a high temperature, fever, which may reach around 40 degrees or 104 degrees Fahrenheit, small greyish-white spots in the mouth, aches and pains, loss of appetite, tiredness and irritability, and a general lack of energy. The measles rash appears around 2 to 4 days after the initial symptoms and normally fades about after a week. The rash is made of a small red-brown, flat or slightly raised spots that may join together into large blotchy patches. It may be harder to see on brown or black skin. Usually first appears on the head or neck before spreading outwards to the rest of the body, and is not usually itchy. Phone your GP urgently if you think you or your child might have measles, and if your child is under 1 year old and has come into contact with someone who has measles. You being in close contact with someone who has measles and you're pregnant or have a weakened immune system. Or you and your child feels very unwell, or you're worried something is seriously wrong. You should phone your GP first before visiting. They can make arrangements to reduce the risk of spreading the infection to others. Who's at higher risk of measles? You might be more at risk of having measles or of experiencing complications from measles if you're under 12 months old, have a weakened immune system, or if you're pregnant. Is measles serious? Measles can be unpleasant, but will usually pass in about 7 to 10 days without causing any further problems. Once you've had measles, your body builds up resistance immunity to the virus. It's highly unlikely you'll get it again. However, measles can lead to serious and potentially life-threatening complications in some people. These can include infections of the lungs, or pneumonia, and brain, or encephalitis. How measles is spread. The measles virus is contained in tiny droplets that come out of the nose and mouth when an infected person breathes, coughs, or sneezes. You can easily catch measles by breathing in these droplets from the air, or if the droplets have settled on a surface, by touching the surface and then placing your hands near your nose or mouth. The virus can survive on surface for a few hours. People with measles are infectious from when the symptoms develop until about 4 days after the rash first appears. How to prevent spreading it. If you have measles, stay off nursery, school or work for at least 4 days when the rash first appears. Regularly wash your hands with soap. Cough or sneeze into tissues and throw used tissues in the bin. Avoid close contact with anyone who hasn't had 2 doses of the MMR vaccine. Or avoid contact anyone with those who have a high risk of measles, like the ones I told you like a minute ago. How measles can be prevented. Measles can be prevented by having the MMR vaccine. If the MMR vaccine isn't suitable for you, a treatment called human normal immunoglobulin, or HNIG, can be used if you're at immediate risk of catching them. Treatments. There are things you can do to relieve your symptoms. Here are the do's. Take paracetamol or ibuprofen to relieve fever, aches, and pains. Aspirin should not be given to children under 16. Drink plenty of water to avoid dehydration. And use damp cotton wool to clean the eyes. In severe cases, especially if there are complications, you or your child may need to be admitted to hospital for treatment. That's all for today. See you soon. Bye.